Prohibition has not prevented the recreational use of psychedelics. It's only made it more dangerous by stigmatizing end users, exposing them to the criminal underground, and stifling discussion on safe use. Our first panel will talk to us about harm reduction in the psychedelic space. Our panelists include Juliana Mulligan, psychotherapist and Ibogaine Harm Reduction Specialist; Alison Hoots, founder and principal attorney at Hoots Law Practice and specialist in the intersection of law and psychedelics; Dr. Kasia Malinowska, director of the Global Drug Policy Program at the US-based Open Society Foundations, an advocate for equitable access to psychedelic-assisted psychotherapies; and Svala Johannesdottir, and representatives from the Matildur Harm Reduction Initiative in Iceland. The panel will be moderated by Anne Harrison, psychedelic journalist and founder of Lucid News. The next panel is Safer Journeys, Navigating Harm Reduction in the Psychedelic Space.
I'm your moderator, Annie O'Carrison. I'm the editorial director of Lucid News, which covers the psychedelic ecosystem and is covering this conference, which we're delighted to do. You can read our story about this gathering at lucid.news. I'm also the co-founder of the WVC, the first US nonprofit organization for psychedelic women, and I design psychedelic harm reduction systems for festivals and events in my home communities in the San Francisco Bay Area. It's my pleasure to introduce our panelists today, and I'm going to join them over here, and we're going to have an interesting discussion. Can you hear me? All right. First, I'd like to introduce Svala Johannesdottir. He's the chairman of the Matildur Harm Reduction Organization in Iceland, and she directs their team, the first service in Iceland to provide harm reduction and psychological support at music festivals and party settings, founded in 2024. She also manages a new harm reduction service for people who smoke opioids and stimulants, which was established in February 2025. Congratulations. Svala's academic training is in sociology, family therapy, and clinical supervision. Her background includes 18 years of working with high-risk drug users and people experiencing homelessness in Iceland. She has directed night shelters for homeless women, a mobile needle exchange, and nurse clinic, and has implemented harm reduction practices into social and housing services. Svala is a focal point for Iceland at the Correlation European Harm Reduction Network, and is among the leading educators on harm reduction in Iceland. Juliana Mulligan is a psychotherapist and Ibogaine treatment specialist dedicated to advancing ethical and safe approaches to Ibogaine treatment and harm reduction therapy for the last 12 years. She is also formerly incarcerated and a former opioid user, having left opioid dependence behind in 2011 with Ibogaine treatment. She currently runs Intervision Ibogaine, which supports clients in preparation and integration around treatment, and offers consulting services for those working on Ibogaine-centered projects. She is also the founder of Indrama, the first Ibogaine treatment training and certification program, and she was a consultant on the Kentucky Ibogaine Initiative and has written and taught extensively on Ibogaine abuse, survivor rights, ethical standards, and safety in psychedelic treatments. Kasia Malinowska is the director of Advancing Drug Policy Reform Opportunity. Their drug policy team promotes drug policies rooted in human rights, social justice, and public health. She previously led the Open Society's International Harm Reduction Development and Global Drug Policy programs. Before joining OSF, she worked for the United Nations Development Program in New York and Warsaw, leading capacity building and drug and HIV policy reform in Central and Eastern Europe and the former Soviet Union. Kasia publishes regularly on drug policy as it relates to women, social justice, public health, human rights, civil society, and governance. Alison Hoots is founder and principal attorney of Hoots Law Practice and is a leading attorney in the psychedelics field in my home country of the United States. She is head policy counsel for New Yorkers for Mental Health Alternatives, working on psychedelic policy reform. Alison also serves as executive director of Sacred Plan Alliance, an association of psychedelic churches. This is a very esteemed panel, and I am delighted to be able to ask our panelists some questions today. Let's start off. I'd like to start with Juliana. What are some of the most important ethical concerns surrounding psychedelic-assisted therapies, such as Ibogaine treatments and others, and also for those who provide psychedelic-assisted therapies? And what should people seeking these treatments think about when selecting an ethical provider?
So it's one thing to talk about ethics and safety in Ibogaine, and it's another thing to talk about all the other psychedelics because of the unique safety profile of Ibogaine. So I'm just going to speak more in a general way about this. Some of the big ethical concerns that I've noticed in the field is around boundaries between practitioners and clients, and what boundaries mean, how to enforce those, not just in terms of consent around touch, but also in terms of emotional boundaries with clients as well. I think one of the issues with psychedelics is they make us all feel very open, and we're all one, and we're connected and shared in so many ways, and so sometimes we can lose track of where we end and our clients begin. And so I see a lot of issues around emotionally connecting kind of in an enmeshing way that can bring up a lot of issues and attachment issues for clients. And so this is something that I always like to talk about is how are you teaching your clients to have boundaries? Because a lot of us are coming from attachment trauma. That's the root of a lot of mental health issues is ultimately attachment trauma. And so you don't want to continue to a cycle of enmeshment with your clients when that's already a big issue. And so, and another thing I like to emphasize a lot is, psychedelics are obviously amazing medicines, and they don't always just increase the positive aspects of ourselves. They can also be very ego-potentiating in a way. And so one thing that I think we've all seen a lot is an inflated sense of self among practitioners and among their role in the client's healing process. So when I worked on this guide with Fireside for red flags when selecting psychedelic facilitators, one thing I wanted to emphasize in particular was around when you're selecting someone, does this person have an inflated sense of self in your healing process? Do they understand that your healing is your healing, that they aren't getting in there and doing it for you? And how are they checking in with you about that and about their role and how big your role is in their involvement? And so on our guide, we came up with some questions to ask to kind of assess for this inflated sense. It's a difficult thing because it can often be very subtle. But when I see practitioners talk about, I can take you this deep, and that practitioner isn't able to do what I can. I heard one practitioner say, I can take you to the beginning of creation, which to me is like, just a very narcissistic way to be talking to someone about their healing process. And so I think something, when we're talking about ethics, is also not just about the obvious things around safe medicine and making things physically safe for people, but it's an emotional safety as well. Because I think some of the most damaging and traumatic things that we've all been through is boundary crossing behavior from our parents, from other people in society. I mean, capitalism breeds boundary crossing behavior. It's all about somebody above you having control over you and you having to submit to what they think is the right thing. And so already we live in a society where our boundaries are crossed all the time by just having to be a part of capitalism. And so I think there's not really a nuanced understanding of what maintaining boundaries is. So that's a big thing. I went on a little bit of a tangent, but I hope that's okay.
Thank you. Svala. As a creator of harm reduction systems, I am particularly interested in drug checking services to provide opportunities for people to test their materials and help prevent inadvertent overdoses from adulterants and psychoactive materials such as fentanyl and other substances. It's a big issue for us in the Bay Area. I'm also interested in developing mediation protocols to address boundary and consent violations at events where psychedelics are used. What specific strategies have you developed to provide harm reduction services at music festivals and party settings in Iceland, which is, of course, where the vast majority of people use psychedelics if they're not involved in clinical trials? Could you also tell us about your harm reduction services for people who smoke opioids and stimulants?
Yes, thank you. So we started the Matilda team, which is a specialized team that goes to music festivals and events in March 2024. It's the first service in Iceland that provide harm reduction at music festivals. What we did, that we decided to go first to 5 festivals, and we provide 24-hour service, low threshold. We have a room at each festival where people can come. We also do mobile service, so our volunteers, they walk around. We also have a phone so they can seek assistance. What we realized is that this was very new for people. We started very late in Iceland to provide harm reduction services, and our first services was established in 2009, which was a mobile needle exchange. So there are a lot of harm reduction services that we haven't been providing for decades, but there is a strong need for it. And what we felt at these festivals is that people loved our services. They loved to have a safe space to talk about their substance use. They loved to get guidance and honest communication about safer drug use. 50% of the people who seeked our services were coming because of drug-related things. The other half was coming because of emotional and mental health issues. And that was the most surprising for me, is that how many people were coming with mental health challenges, like suicidal thoughts or a lot of struggle with anxiety, or open up for the first time that they are hearing voices, or opening up of old trauma. So I think when you provide such a low threshold service, people are likely to come and seek your help. There were 200 people who sought our services last summer, and we provided around 330 interventions. We saw that part of the people who were seeking our services were using psychedelics, mostly psilocybin or LSD. Some people came because they wanted a guidance or safer use or about doses. But some people were also coming because they were really struggling. They were not in a good place. They didn't feel safe in the environment. And then in our service, we always provide a safe space where people can come and they can rest, and we can stay with them and guide them out of the difficult part and in more kind of relaxing, calmer part. I've totally forgot your questions. But I remember that you mentioned about the drug checking. So we don't have any drug checking facilities in Iceland, which is very sad. But what we have providing in our organization is that we provide simple testing. So at festivals and in all of our services, we provide these simple tests that can tell you if you have fentanyl in your substances, or we are also testing for nitazine, which is also a strong synthetic opioids. And we can test for various things, but we don't have the specialized tool to do it more professionally. But we do something, and this is very important for people. They were coming to our services a lot because they wanted to check their drugs. And what was so important for us is that we really realized that young people especially, because 65% of the people who came to us were under 28. And they are really calling out for this type of services, and they want much more of it. We could do much more, but our main challenge is funding. It's very difficult to get funding for harm reduction service in the nightlife. So yes, did I answer any of your questions?
Very, very much so.
Okay.
Tell us about the services you provide to people who smoke opioids and use other substances.
Yeah. So for the last 5 to 10 years, there's been quite a lot increase in people smoking opioids and cocaine and methamphetamine in Iceland. And we always wanted to have a specialized harm reduction service for this population because they are not, most of them are not seeking harm reduction services that are in Iceland. So 4th of February, we went the first shift. We are mobile, so people can call us, and we come with a service wherever you are in the city. We also assist everyone in the country through phone calls, and then we send them the packets of safer products. And we have an introduction table where you can see all of our products. These are products that are harm reduction equipment that people are allowed to inhale. So we have pipes, we have filters, we have foil that is clean, we have drug testing, and then like in all of our services, it's a lot about guidance, safer use, prevention of overdoses, and then we are assisting people to get into opioid agonist treatment.
Very impressive.
Thank you.
Thank you. I'd like to do a shout out to the organizers of the Boom Festival in Portugal, who were among the first people to provide public, no questions asked, free drug checking services. It's a service that I made sure our events provide. We do it through DanceSafe, which is another nonprofit based in the US. But the Boom Festival really set the standard, and we've been looking towards our European friends and partners for many years to set high standards for harm reduction that we aspire to follow. So thank you. Of course, there are many people using psychedelics in therapeutic, ceremonial settings for psychedelic-assisted therapies. And in the US, this, unless they're using ketamine, is underground. These are underground services, underground providers at present. Allison, what are some of the greatest harm reduction challenges facing practitioners therapists, and also religious organizations. Of course, we do have psychedelic churches in the US, and they exist in other parts of the world, of course, as well. And as an attorney, what trends do you see in psychedelic communities contributing to new ideas for conflict resolution?
Okay, there were a couple questions in there, so I'll start with the first, which is the greatest harm is prohibition. The legal status, which is illegal, of any substance that has a hallucinogenic effect or is listed actually on the Controlled Substances Act is illegal. And that really curbs access to some of the greatest forms of harm reduction, which is education, screening, information from your doctor or your therapist, if that's what you are currently taking advantage of, that continuity of care if you are going underground, meaning some preparation, some follow-up, the way that medical and healthcare providers' hands are tied in many states is significant and incredibly harmful. The inability to confidently call for emergency services is a huge problem. And the sort of hesitation to be as transparent for these underground practitioners. I joke that pre-2020, everyone said they were having meditation circles, and all of their documents said, you know, come join us for this weekend. Post-2020, and with all the work that I do in the space, informed consent that is very clear and honest is really important. In the religious use space, there's a uniqueness in the US, which is that there are some laws that would allow someone to say, the work I'm doing with this illegal substance is actually protected as a religious use, and I should be exempt from the Controlled Substances Act. And there is precedent. There are cases that have granted it. There was a settlement that has granted this exemption for religious-based activities. It's pretty unique in the entire world that this exists, this framework. And so in that context, there are really crucial parts of saying this is religious, because that's a particular context that could be harmful. You should describe your religious beliefs. You should describe the substance explicitly. You know, there's some very interesting sacraments being used currently that are a combination of substances, or just, you know, now what I say, your ordinary ayahuasca, which because of the breadth of sacrament types now. But that clarity really does empower the individual to determine if it's appropriate for them, if the context is appropriate for them. I'd say this is true in even the ketamine space, where there's ketamine-assisted psychotherapy. You know, being able to know what your practitioner is into, you know, what kind of therapy they're going to provide is really important. And I think one of the problems with the underground space and even the above ground space is accountability. There is a lot of shame sometimes around even legal therapy, but then imagine underground therapy or religious ceremony. The way to report a harm or just even a concern, and having resources like a therapist or even police to speak to about concerns concerning behavior, breaches of boundaries, actual assault. That's something we're really trying to consider. What does that look like? Whether are spiritual contexts, that resolution process is going to look different. If there's a culture around that use, having attenuated types of ethical review and support is going to be, you know, it's all nuanced. Each substance, each context is so specific. Each individual and what they need and the kind of harm that needs to be addressed is so specific. We have to figure out what works for each person so that they feel empowered and safe in reporting and working through these issues. And so it's a big challenge. I know Annie and I are working together a little bit on that. And what do ethical standards look like in each of those contexts? Some communities are very into touch. they need to disclose that. That has to be consented to. How is that consent revoked in an altered state? And that's something we're really trying to determine. What are those mechanisms? And so in my policy work, I address the prohibition issue, which is a really big challenge. But there is policy now in New York that would create user permits for psilocybin on an individual basis outside of a medical context. It would be the first legal individual use in the United States, which requires a screening and education. In my law practice, I develop informed consent based on context. We talk about touch. And then at the Psychedelic Church Association, which is called Sacred Plan Alliance, we talk a lot about ethics and accountability. We have our own ethical reporting system, so our members, which are churches, share with their members who are congregants a link to Speak to Us, which is an ethics committee, to report concerns, because nothing else exists like that. So I'm really focusing on all of those contexts, even working on ketamine-assisted psychotherapy, informed consent, and trip sitter informed consent agreements, and what does this all look like in practice?
Thank you. It's a pleasure to work with you on these issues. There are a lot of big questions in front of us.
Yes.
Yeah. Kasia, what are some of the most pressing harm reduction issues engaged by global drug policies that impact people around the world? And how do harm reduction strategies impact human rights and social justice?
Thank you, Anne. So let me start answering those questions by spending a second situating myself in relation to all of you. So I've been working on harm reduction and drug policy for roughly 3 decades. I came to this table because of the HIV epidemic. I'm Polish. I was really interested in bringing harm reduction concepts and ideas to Poland, former Soviet Union, where HIV was driven by people who injected drugs. And so in that process, many of the observations that you shared about your clients were also true. No injecting drug user told me that they don't want a clean needle and syringe if it's being made available to them. I've learned that if you treat people like responsible adults and provide health services for them, make them available, they will take them up with a lot of gratitude. No one said they preferred a dirty needle. No one said they preferred risky behavior if they have a choice. And I think this is what we have learned over those 3 decades when it comes to heroin users and users of many other psychoactive substances. And I say this because I often feel like discussions around psychedelics, which are beautifully curated, which are in those stunning bubbles of sort of warmth and engagement, somehow think that they're the only ones. And so I guess I really want to point out that what we're doing here is a continuum of drug policy reform, a continuum of harm reduction that have started many, many years ago. And we're not discovering something new. We really are standing on shoulders of others who have done that work before. And I think that it's important to point this out because in psychedelic, and I don't say we in psychedelic community because I feel like I'm a little bit on the margins of psychedelic community, but I often hear statements like, well, at least we're not potheads, or at least we're not junkies. You know, our drugs are better, they're mind expanding. I think for purposes of what we do in the world and goals of drug policy reform and ending prohibition, something that you've mentioned, that prohibition is our enemy, those statements, those assumptions are not helpful. I think recognizing that we are continuing work that has begun and that we are benefiting from that experience, in my view, is important. Whether it's a policy discussion, whether it's a discussion of COCA rescheduling at the UN level, or making sure that drug checking in Iceland are available. And so one additional point that I wanted to make, and thank you for the shout out to Boom. I'm a sitter at Boom in Cosmic Care. And I think what people don't realize in psychedelic community is that the reason Boom and Cosmic Care was able to offer such wide range of services, harm reduction services to psychedelic users so early in the process, is because 20 years ago, over 20 years ago, advocates for decriminalization of all drugs made that happen in Portugal. And because drugs are decriminalized in Portugal, then making harm reduction services available became easy because there was no anxiety that the festival has to pretend there are no drugs. Of course there were drugs, and of course services needed to be put in place. And so this connection between how psychedelic community fits into the larger drug policy is really important to understand because, again, when discussions are taking place about decrim in Oregon, in Maine, in Germany, it is really important that we stand up. We come in and stand up for folks who are making those efforts because we as community in long term will benefit as well. My daughter's name is Kaya, and this is why I remember actually a Burning Man representative coming to Boom to learn about harm reduction services. And she was in awe. She said, you know, our festival could never dedicate $500,000 above ground to harm reduction service because that would mean that we would be telling the feds, we know that there's drug use here and that we condone it. And so, of course, fantastic harm reduction work happens at Boom, at Burning Man, but it happens differently, right? Different logistics need to be put in place because the festival itself needs to make itself a step removed. So again, this connection between decrim, drug policy reform, criminal justice reform, harm reduction, we're all one. And only if we're all one and we all own it, we can expand those services. We can have legitimate and overboard conversations about ethics and consent. And so my call here today, and throughout the next 2 days, I'm on a stage a few times, is to let's find ways to amplify each other's voices, speak up on behalf of each other's interests, because siloing and putting ourselves into this pretty psychedelic bubble, I don't think will work in long term. When it comes to policy, services, and everything that we wish for ourselves and for people that we love and that we work with. Thanks.
Thank you. think your point about Burning Man is interesting. I'm a longtime burner. I founded a tea house at Burning Man called the Full Circle Tea House, and a camp to support that tea house, which was the inspiration for a service called the Zendo Project, which provides harm reduction services at Burning Man and is now extending to county-level mental health services in the U.S. And it's just a joy and an honor to work with those people. And also I want to do a shout out to other event producers like myself who have stood up to the RAVE Act and other legal barriers to recognizing that people use psychedelics and other substances in social settings and that they need to be supported and services for harm reduction need to be provided at those events, regardless of the law in the US and other places. I'd like to ask our panelists, and anyone can answer this question. There is a growing market offshore in the US because of our legal provisions for therapeutic services, such as Ibogaine clinics, for example, and other ceremonial sites, other services that are providing psychedelic-assisted therapies and spiritual services around the world. Certainly in the US, because of our legal restrictions, people are increasingly seeking these services. What kinds of harm reduction approaches do you think providers of these services should be thinking about? And Juliana, I'd like to start with you first, and perhaps you can talk about Ibogaine providers in this context.
You're asking about what harm reduction they should be implementing at like the clinic level,
Correct.
The clinic and retreat level. Whew, there's a lot to say about Ibogaine. I think without going into the nuance of all the safety cardiac issues that you have to attend to with Ibogaine, one thing that I notice with a lot of clinics is that they make the mistake of pushing one particular goal, agenda, or philosophy with their treatments. Often, it's measured, like the success of Ibogaine is measured based on abstinence from all substances, and that's just not the right goal for everybody. Any change in a substance use pattern is a success, and so I think that providers need to allow the clients to decide what success is for them rather than pushing this agenda that you're never going to use opioids again, and if you do, it's a problem and you need to come back for treatment. This just isn't the case for everybody. A lot of people do Ibogaine and maybe they don't stop using all their substances, but they use them less or they use them safer. And along the next few years, they make healthy changes in their life, and then maybe they do stop eventually. But the one and done Ibogaine treatment, which happened for me, I never did opioids again, but that's not the only version of success. And so you have to, another tenet of harm reduction on the philosophical level is you have to support people in whatever their truth is for them. And so that means not pushing the disease of addiction model, for example, not pushing 12-step philosophies on people. That's something that really upsets me at clinics is when they start pushing this antiquated, unscientific language from the 12 steps. Sorry not to trash talk 12 steps, but I know it helps some people, but it is not based on science. The disease concept of addiction is not based on science. It was invented by a charlatan. And so you can't bring that kind of antiquated, outdated terminology and philosophy into treatment, because then what you're telling people is that you have this problem forever and there's nothing you can do about it, and you can relapse at any time, and the only way that for you to be successful is to never use substances again, and that doesn't pair well with Ibogaine or any psychedelic. Psychedelics are about everyone's unique journey with substances and any other behavior. There's not going to be just one way for somebody to heal. And so when people come to Ibogaine, it needs to be, what are your goals? What works for you? Not, here's what we think works. It's being curious. And I honestly don't see a lot of curiosity among Ibogaine providers or psychedelic providers in general. It's like, we know what's best and here's what you need to do. And if someone is asking for guidance, that's one thing, but I think that we need to work with our clients so that they feel empowered to sit and think, oh, actually, what is success for me? Because society is telling me I need to stop using drugs forever. But does that resonate for me? Does that actually work for me? And I think a lot of people, especially those that struggle with substance use issues, are traumatized by bad treatment from being told that you don't know any better, you have a brain disease, so you need to listen to us and do what we are telling you to do. And there's not a lot of, what do you think you should do? And so a lot of what I end up doing with clients is helping them to recover from antiquated harmful treatment. It can take months sometimes for people to realize, oh wait, I'm not powerless, I'm very empowered and intuitive person. And so what I want to see at Ibogaine clinics is more curiosity and more spaciousness and less of this is how addiction works and this is what you need to do. So I think that's really the biggest thing for Ibogaine.
Thank you. Yes, please.
Same. Okay. I think one trend here is the issue of psychedelic exceptionalism, that one substance is better than another or should be decriminalized over another, and I think that is a real problem. And while I would say politically, certainly some will move faster in the United States in that direction, attitudes of psychedelic exceptionalism are problematic for the issues you just mentioned, but also because they're all substances, people should be able to choose what works for them and make smart choices. And in making smart choices, I'm always going to come back to informed consent. It's really important that the substance specifically is shared, and not just what the substance being shared is, but very detailed discussion of risk. Someone should go in fully informed of what the experience will be like, not just what the practitioner presents, but the realm of possibilities of an experience. I had someone say once, we should show a video of what a psychedelic experience might look like, which I love. But also just the potential harms. You know, there's short-term and there's serious, ongoing long-term that can happen, which is why screening is really important, but also to say there are unknown risks that could happen, very serious ones, and you need to assume that risk, that if this is really something you want to do, know there is this potential of something very harmful. And then the last thing I would say is repeating this: don't guarantee outcomes, ever. You won't be cured. This isn't the solution. This is a tool, this is a route, this is an experience with risk. And yeah, that's really important for me to say. That is so individualized, and to make room for their experience and to support it.
Thank you.
So for me, because I have directed a few harm reduction services, I think we have to always go to the principle of harm reduction is autonomy, empowerment, meeting people where they are, and we need to work with our clients. And I see this, and I'm so happy that you mentioned this, because we are all struggling with the same thing: drug policy, prohibition, stigma, misinformation. And we need to look at it as in a larger picture. But when it comes to the principle of harm reduction, I think I think the therapist community would benefit a lot of client orientation. It's like when you build up your service, or you're doing protocols or ethics stands, you need to actually work with the people who you're going to work with. And all of our services in the Matilda organization, we are very client-oriented. We don't put any information out there, or even a poster, or how we organize all of our services. We always talk with our client group and ask, what do you feel about it? How should we do it? And we have to be genuine on listening to the challenges and what we can do better. And I think this is often a a challenge for professionals is to actually have the space to see that you are possibly not thinking it in the right way, or you are actually not maybe doing the best work, and to have the space for it, if it answers. Yeah.
Thank you.
I know we're out of time, so I will just offer the following: respect people's agencies, and do not put down anyone else's drugs.
Yeah, thank you. I think that's the perfect ending to this conversation. And I'd like to thank all of our panelists today for a very interesting discussion. I'd like to thank the organizers of this conference and all of you for listening to us today. And please continue the conversation about harm reduction. It's very important. Thank you.